Hi, everyone. My name is Anthony Wilk. I'm the Development and Marketing Coordinator at Cairn Counseling. Joining me today to talk about the clinical residency program are Clinical Director Julia Pickup and Resident Therapist Emily Klamer. Julia and Emily, thank you for joining me this morning.
Thank you,
You're
Anthony.
welcome, Anthony.
Julia, if you'd like to start us off by providing like a broad overview of the program and perhaps highlight a couple of aspects that make it unique compared to other similar opportunities that are out there for interested applicants.
Sure. So our clinical residency program is really rare. What we do is we combine ongoing clinical education and training simultaneous with clinical practice and supervision. So what is really unique is the opportunity to not only practice while getting your license, but to also be trained in depth in psychodynamic work and how to be a therapist and how to effectively have a practice. We incorporate peer learning components, which is one of my favorite parts of the group, is we have other resident therapists, typically a cohort of at least a few training clinicians who learn together and practice together. We have really excellent staff on our team who provide training, support, education, and give the opportunity for our resident therapists to learn from. And it's also unique because we have really intensive coursework that is done. It's like postgraduate courses, actual courses with readings and meetings and discussion, where you're taking the theory that you've learned a little more in depth and applying it to your cases and hearing other people apply it to the clients that they're working with, which is just such an enriching experience that I wish I had had as a clinician myself. And yeah, the really kind of unique thing about it also is that Cairn Counseling has 3 pillars that we build all of our education and clinical practice upon, which is psychodynamic psychotherapy, family systems, and spiritually integrated therapy. And the spiritually integrated component is particularly unique to Cairn Counseling. We are an interfaith organization that serves people of any faith, any spirituality, or not of faith or spirituality, but really looking holistically at how people's spiritual family systems and their inner working experiences all play out in how they're feeling and functioning right now. So I think, yeah, typically the program lasts 1 to 3 years. Most of our clinical residents are here for 2 years. And we do have 2 different certificate programs that we offer. We have one that is about the coursework and completing that, and which is a great certificate of study and offers CEUs. And we also have the supervised experience certificate, which typically takes 2 years to complete.
Emily, as someone who's been in the program for a little over 1.5 years now, can you share your thoughts as someone who's lived the experience?
Like Julia said, it really is holistic, like everything from group and individual supervision, case conferences, seminars by staff members or staff therapists at Cairn Counseling, psychiatric consultations, resident meetings, not to mention overhead. Cairn Counseling is a perfect place to start your career if you're interested in, the 3 pillars that guide Cairn Counseling's mission and its work.
Is there anything that you wish you had known prior to applying?
Something that Cairn Counseling has provided that no one could have anticipated was the transition to telemental health status when we all had to move to telehealth methods for COVID. Like, I cannot imagine having gone through the past year without kind of this overarching community and support system that Cairn Counseling provides. I did not want to go through this alone. I can't imagine what it would have been like if I had been alone. It just feels like a professional family, and we are really there for each other. So it's a really unique and like kind of precious program, I think. So in terms of applying, I only wish I had done it sooner. Like, I was considering applying the year before I started. And everything like shakes out how it's supposed to, and I'm happy with where I am. But yeah, it's so amazing. I wish I had started it a year earlier.
Is there anything else either of you would like to add before we get into the application process? Words of encouragement, maybe?
I think it's helpful for people considering this program to know how many different specialties we have on our staff at Care and Counseling. We have folks who have been practicing for up to 40 years or more and have really unique specializations, and the opportunity to learn from them through the coursework, through the seminars, case conferences, just by being on a team and be colleagues together, I think is really phenomenal. And I do also really love how each resident therapist can make their experience pretty unique. If they want to carve out a special niche for themselves, they can do that. We can help support them on developing a special area of practice. But we really do learn collaboratively. And I do love that I get to spend a lot of time with the residents. They get their, as Emily mentioned, their individual supervision. We work as a group together. They get to benefit from the expertise of our psychiatrist. It's just such a neat process to watch everyone learn from each other and grow individually as well.
Yeah, I think I would just say, like, start the application sooner than you might expect. Like, it is kind of an intensive process, and the essay took me a while. So
To apply, we encourage you to check out our website where we have an application form and additional information about the program. The application does require sending us your transcripts and essay of an autobiography about yourself that will help us determine why you are potentially a good fit for learning with us here. And we will complete interviews with candidates that look like good potential fits to get to know if you might be a good fit for our program and if we might be a good fit for your career trajectory. And applications are due April 2nd, and I do welcome potential applicants to contact me if you have any questions. My email address and phone number are all over the website, but it is 314-336-1041.
And interested applicants can also reach out to me, and I'm sure any other resident currently in the program if they have any questions. And you can gather our contact information on the website.
careandcounseling.org/careers-resident. Emily and Julia, thank you for joining me and sharing about the residency program.
Well, you're so welcome, Anthony.
You're welcome.